Now we are going to have a topic of respiratory burst. It is this mechanism of killing the pathogens. It is also called the oxidative burst that involves the activation of phagocyte NADPH oxidase complex in neutrophils and monocytes, and they use the oxygen as a substrate. That oxygen is converting the oxygen radicals, and it's happened NADPH oxidase. NADPH oxidase. And they plays an important role in immune response, rapid release of reactive oxygen species. NADPH play a role in both the creation and neutralization of RS. They can neutralize and can create the reactive oxygen species. Myeloperoxidase contain a blue-green heme-containing pigment that gives the sputum its colors. Guys, you know, whenever you have a bacterial infection, you go for coughing and the time, therefore, colorish, the green or blue colorish sputum is coming. That is due to myeloperoxidase. Due to myeloperoxidase, the sputum color having that bluish green. There is a non-state microbe. Non-state microbe means it is a mnemonic that NADPH oxidase is going to release superoxide dismutase, and that is going by myeloperoxidase. What is going to happen? The oxygen convert into radical, and that radical going to become a hydrogen peroxide, and the hydrogen peroxide is combined with chloride ion, and then it become hypochlorous acid by the help of myeloperoxidase. So that myeloperoxidase go and give the end stage or destruction of bacteria. Understand? And there is one important point like that. If some person is having the deficiency of NADPH oxidase, so that disease is called chronic granulomatous disease, CGD. In that disease, the body is unable to produce oxygen radical or hydrogen peroxide, but in that time, they can use the hydrogen peroxide that is produced by the bacteria itself and use that hydrogen peroxide molecule to kill that bacteria. But some of the bacteria are catalase positive. They break down the H₂O₂, hydrogen peroxide themselves, so our body can't use that hydrogen peroxide for killing them. So in this disease, in this chronic granulomatous disease, they have the recurrent infections by catalase positive species that are H₂O₂ and Aspergillus. And then the phagocytes of a patient with CGD can utilize hydrogen peroxide generated by invitic organisms and convert into radical oxygen species. The patients are at increased risk for infection by the catalase positive species that are H₂O₂ and Aspergillus, capable for neutralizing their own hydrogen peroxide and leaving phagocyte without radical oxygen species for the fighting infection. The pyrocanin of P. aeruginosa generate ROS to kill competing pathogens and oxidative burst lead to release of lysosomal enzymes. This just an immune response or killing of bacteria by the free radical, and this is already discussed in general pathology free radical topic if you guys remember.